Community Forum. Community Forum is a new sponsored program by ADS that is by the demand of the members and by request that once in a while we started. And in this forum, we have a different setting in the sense that the speakers will talk about their personal experiences, personal advice from a patient's perspective or an expert's perspective that they feel that they are expert in this field. Today, I have the pleasure of introducing Mr. Satish Jalota that most of you know, but I have his bio here and I would like to share that with you. In 1967, he was in Punjab University, where he did MSc, which is Masters in Science and Physical Chemistry, in Chandigarh, and then he had a PhD in electrochemistry from University of Glasgow in Scotland, 1971. And then he continued to have research in the same field for many years. And what he was actually doing was that he was separating the human blood proteins that carry the vitamin B12 using a liquid chromatography back then, so many years ago. So as you can see, there is a lot of experience. He was also engaged in the application of electrochemical principles in the manufacturing of housing for medical devices like pacemakers, which require utmost care in meeting stringent FDA requirements. So he has done a lot of work in this field. But today, what he is going to talk about is that during his employment, he was flying between Scotland and New York and San Francisco for several years. And probably because of this travel and stress, he developed excruciating low back pain. Surgical interventions were unsuccessful. He ended up in L5 nerve damage and related severe left foot drop. So thank you for sharing that personal information, Jalota ji. So because of his medical condition, he took early retirement and turned into neuropathic ways of healing healing to regain his health, and he did regain his health back. So now he lives a retired life in Stockton, California, your favorite town, free of back pain and free of any pain for that matter. During this presentation, Jalota ji wishes to share his encounter with the back pain and how he conquered it without allopathic medicational intervention. He has a message for those who have started to suffer from back pain and are already suffering, that there is hope. And if you are ready to give up some lifestyle that precipitated back pain in the first place, and you are ready to adopt a lifestyle that can make you pain-free, or at least you will be able to manage your pain, the choice is yours. So without further ado, I would like to reintroduce Mr. Jalota ji. Remember that we always say that ADS sponsors the event, provides the platform, but this is not advice from a patient or a doctor perspective. This is educational, and it does not by any means constitute a medical consultation. By permission of the speaker, you can contact them personally if you would like to continue your conversation regarding your personal problems and their advice. So you can choose personally. With that, Jalota ji, please go ahead. Thank you.
Folks, this presentation made about pain and particularly back pain. Pain is a function of medical disturbance in our body due to an underlying medical condition. Whether the medical condition benign or serious, it must be attended to. Medical disturbance gives us signals of distress, and we describe it pain. Pain is an effect of an underlying cause or causes. The underlying causes can be multiple, such as degeneration of our bones and joints and an injury old or recent. Other reason is lack of oxygen in our blood due to lethargy, lack of exercise, and muscular dysfunction in our body. Low back pain. Back pain is commonly known as low back pain. Low back pain is common among information technology IT professionals who sit a lot in front of monitor. It's also prevalent among professionals who drive long distances for their livelihood. Low back pain is also most prevalent among seniors. We seniors might not remember a day when our low back didn't bother us in one form or the other. Dealing with low back pain. A disturbed back causes excruciating pain and becomes devastating if not attended to. Devastation can be so severe it upsets your partner, your husband, wife, because of you are always in pain. Relationships go sour. People who are suffering from this disease. Treatments are symptomatic, which rarely are specific to patients' underlying condition. There is rarely a solution off the shelf that a health professional can prescribe. Dealing with back pain is more of our own responsibility, and medical professionals can only assist us in its management. Question is, how can we become pain free or at least be able to manage it? Answer lies in the understanding of cause and effect relationship. Our lifestyle is the cause, effect is pain in the back. We created it, we can correct it and become pain free. Now we come to understanding human spine. Shown in this picture is on the left side, there's a normal human spine, human body with normal human with natural curvature, two curvatures there, upper one, lower one. There's a normal vertebrae and nerves coming out of the spinal cord, upper and lower. But see on the right side, you see the lower, this picture where my arrow goes there. This is a normal disc with jelly type material in it. There is a spinal cord. Out of spinal cord, nerves are coming out here. There's a vertebrae. However, for lifestyle, particularly a person who uploads a truck, goes to Texas, comes back within 2 3 days, and he's driving many miles there and he's resting on his seat. He's copy on of the right hand. He's tilted toward driver's door, trying to rest. There's a curvature in his body while driving it. That curvature puts 70%, 75% torso weight on 25% of the disc. That pressure goes on and on and on. It's not a pressure, not a month or weeks or months or years, several years can take. When your disc gets start affected, gets under pressure, start crumbling. That when that crumble, the picture is shown in the lower picture, this picture here. You see this disc has deformation has taken place. It has bulged out. It has hit the spinal cord. It has hit the nerve coming out of the spinal cord. Reddish net shown in the spine on the nerve is inflammation. That inflammation causes impediment in the flow of blood. If the flow of blood doesn't go where that nerve goes, if that nerve goes to the hips, to your feet, your legs, you will have a pain. It goes to the back, rest of the back, it will give you a pain. Back is not the cause. Cause is lying in that nerve, which from your lifestyle. You have damaged your list over the years. Further developing this cause and effect relationship, the cause and effect relationship, the cause is muscular and musculoskeletal imbalance. The effect is pain in the back. Back itself is not the cause, and the cause is somewhere else. There is cause and effect relationship. That cause is structural imbalance. The effect is pain in the back. Decrease your structural imbalance, improve your posture, decrease your stagnation in muscles, exercise daily and routinely, eat to necessity and healthy food. Do not fill up your stomach to the full. How we say how back, those who suffer from it, how back pain is diagnosed. We are normally informed that you have bulged disc, herniated disc, inflamed nerve, pinched nerve, bone spurs, spinal stenosis. Diagnosis for first three items: bulged disc, herniated disc, inflamed nerve. above are treatable without surgical intervention. Normally, mostly not 100%, mostly treatable without surgical intervention. However, diagnosis for items 4, 5, and 6, which is pinched nerve, bone spurs, spinal stenosis, may need surgical intervention as there may be a major underlying cause not understood effectively. What is the central cause? Central cause, what is that? The central cause is muscular dysfunction or muscular imbalance coupled with inflammation of joints and at cellular level. At cellular level, symptoms are just the effect of imbalance and inflammation in our muscles at places other than our back. If we can understand this muscular imbalance and inflammation, and if we can deal with them, we can be pain-free or be able to manage it. How back pain is diagnosed now, how back is treated. Back pain is in its early stages, then back pain in its advanced stages. Back pain is early stages is treated by bed rest. Couple of weeks, doesn't work. A month after, go back to your physician, you'll get painkillers. Go back a month after, 3 months after, it comes back. Why comes back? Because the things you are doing, you're not tending to that. You are relying on the medicine, not the lifestyle, which is creating it. I'm come to that. Why it comes back again and again and again, and it comes worst. If there's a Murphy's law, some scientist law that if something inflames up, you treat it, does not go back to 0%. It leaves some remnant behind. If you're 100% gone inflamed, come back 10% is left behind, but we feel all good. Next time comes back, that 5-10% goes to 15-20%. Year after comes back, it goes 20-25%. We get used to, be still comfortable with that. However, over a period of several 4-5 years, this starts crumbling. So anyway, bed rest, painkillers, physical therapy, chiropractor adjustment, acupuncture, acupressure. In the advanced stages, there is an epidural space in our spine. They inject steroids called epidural material. And that steroid, again, that helps you numb down the pain, get you feeling of no pain. It's very effective at times, particularly in early stages, if done. If not, lifestyle still there, pressure on the spine still goes on and on. You go to next time, you go to the physician again, send you to the specialist orders MRI or CT scan. It shows, yes, you have a pinched nerve, you have spinal stenosis, you have bone spurs in your vertebrae, you are a candidate for back pain, for surgery. Early stage back pain, it is treatable by modalities like trigger points, by chiropractic adjustments, physical therapy, acupuncture. We took it earlier, however, I'm repeating it. These are very beneficial and must be tempted and exhausted before tempting major intervention. Advanced stage of back pain is normally handled in the following sequence. Epidural injection, we talked about MRI, CT it's just repeating itself. Okay. When none of the non-invasive techniques such as epidural injections and MRI is taken to ensure necessity for surgery, then we are advised that we will need surgery. However, there is an alternative. There is a possibility that surgical intervention for low back pain may result in nerve damage anywhere at L3, L4, L4, L5, L5, S1 area. There can be nerve damage, very high possibility. Although excellent microsurgery techniques have been developed, those attend 2 areas only, L3, L4, L4, like that. Otherwise, you cannot go all the 3, L3, S1, you cannot go with that. You can have early stage 1 level only, L3, L4, L4, L5, you can handle with microsurgery. They're very successful, very, very successful. However, in any event, nerve damage is always possible. Nerve damage may lead to partial paralysis of a limb, like foot drop, which I developed. There are alternative natural ways to manage back pain. What are those natural ways? To explore natural alternatives, let's consider cause and effect relationship once again. The cause is structural imbalance, effect is pain in the back, decrease your structural imbalance, improve your posture, decrease stagnation in muscles, exercise daily routinely, eat healthy. We go again, I think I got duplicated it. Then also go for a mile or two of morning walk daily. If back pain doesn't retreat, explore if you have structural imbalance. Now we come to real stuff here, structural imbalance. Shown in this picture here, take your time to understand the two pictures of human body here. What is structural imbalance? On the right side, you get a nice human spine, nice curvature in the spine there, well-built body, tummy is not bulged out here. However, folks, in the left side, your tummy has bulged out, not bulged out tummy from your normal growth in life, not that type of tummy bulging out. Tummy bulging out when you have been going out on Friday night, Saturday night, you have given a donation of $100 and there's a free $20 dinner with it. You go, you get pakoras, samosas, tikki and all the chaat and wine and beer, all that. Then you have your dinner at 9:30, 10 o'clock. You go home by 12 o'clock. All that junk food, no oxygen in them, no nutrients in them. You eat just sitting in your stomach. You go fall asleep. That type of lifestyle ends up your tummy bulging out there. And you're saying you're having very first class life here. Not so. You are selling your health over there. So there's a bulging out stomach. Obesity causes forward pull on the spine. You can see here your spine has been pulled forward toward the stomach. What does it do? The spine has a normal curvature. It's like a bow and arrow bow. But when it's pulled out by your lifestyle, this one bow is under more tension. Spine is more, vertebrae are a lot under tension, under stress, continuously, not our days or weeks, continuously is under stress. And they develop weakness in them. They try to crumble, they can't support it. And their normal position is also affected, normal, because there's a distance, equal distance between vertebrae. However, when you pull it, two vertebrae will be imbalanced. They won't be parallel on each other. They will develop, one side of the two vertebrae will be shorter, other side will be more open. And that affects your spinal cord also, and your nerves coming out of spine, they're all affected. This bulging of stomach and your spine under stress causes, what does it cause? It causes if you see this is normal spine, you see that your buttocks nice and beautiful here. However, if you see here, your buttock has sunk down because your bulging of stomach had pulled your buttocks outward. When these buttocks have been pulled outward, is pulling out your vertebrae, is trying to imbalance all the nerves, muscles in your buttocks area, not in the back yet, in the buttock area. This totally out of shape. And when the bulging out will be on the left side or the right side, depending on how you drive or you sit. It not be uniform bulging out. It will be to the left or right. Mostly to the left, because we get into the car from the left, get out of the car on the left. When we get out of the car, we put pressure on the left buttock to get out. Torso weight goes on the left buttock when you put your legs out of the car. That process continues for years and years and affects your spine. Left side more than right here. And this bulging out, this formation of your buttock, what does it cause? It causes the left buttock to sink. You see in this one, normal buttock, normal places here, normal one. If you on this side here, left buttock has sunk down. There's a difference between the two, height of the two. This type of thing gives the impression that your left leg is getting short. That's a very, very wrong impression. I was told that. I was put in these spacers. Here I have some spacer like this one. Put spacer in your left shoe. That gives you temporary remedy, not this thing has not been attended to. Nobody told me. No, I have no bias against anybody, but in my case, I was not told here. This sort of thing here. You put it, but what happens even if you have these spacers in your foot? Still, the deformation continues with the lifestyle. That doesn't stop. Deformation does not stop. It can delay it. This software device can delay deformation. Now we come into types of back pain. We already established muscular imbalance causes three types of back pain. Now we normally know sciatica. I have sciatica. You talk somebody has sciatica, but there are three types of back pain. One is a myofascial pain, sciatica nerve pain, piriformis syndrome, muscle syndrome. The three types. There are three places. One place is the myofascial, that is number one here, right here. Second one is L5S1 area. Third was in the muscle. Peripheral muscle is in your buttocks there, beside the spine, where the sciatica nerve goes is above that at right angle to that. I'm coming to that. Coming to first one, we dealt with that. Myofascial syndrome typically occurs due to what? Due to lifting heavy objects, repetitive motion. People who load, unload stuff from the trucks there. You're sitting in your shop, lift heavy object. That affects your myofascial muscle. Long distance driving in a posture position, stop and start driving, serious lack of exercise, lethargic lifestyle. These are the cause for first type of muscle pain. Second type of muscle pain comes from sciatica pain. What is sciatica nerve pain anyway? What is definition? Pain due to disturbed state of sciatica nerve is termed sciatica nerve pain. Disturbed state. Just saying I have sciatica pain means nothing to me. Saying sciatica pain, I have a deprivation of oxygen supply to the sciatica pain, then I can understand. Simply saying sciatica nerve means nothing. So it's due to sciatica pain due to disturbed state of sciatica nerve is termed sciatica nerve pain. And where is sciatica? Here comes from your buttocks and your hips down the legs, either side of the legs, all the way to the feet. Third one is piriformis muscle syndrome. What is piriformis muscle syndrome? A picture of piriformis muscle syndrome compressing the sciatica nerve is shown here and there. Here are the piriformis muscle here. Left side and right side is in the buttock. These muscles help your legs move left, right, and forward. Very, very important muscle. But if this muscle gets inflamed, irritated, compressed, and sciatica nerve going right underneath here, that is sciatica nerve right underneath. Not much difference from there. The distance is maintained when your piriformis muscle is healthy, as is strong, it gets its oxygen, there's no irritation in it. They both, sciatica nerve, and they work together. They work hand in hand. You don't get a pain. You move your legs left, right, twist it reads, run it. They don't get, they're taken care of it. However, patients who get it, they have a deformation of piriformis muscle, particularly if you are getting your car, getting out, getting in, getting out, and you're putting your torso weight on your left buttock, it eventually can bring that up, this situation back up here. So anyway, when does piriformis muscle syndrome occur? What does it occur? It occurs when the piriformis muscle spasm irritates or compresses the sciatica nerve underneath here. That's very, very serious. It's a double damage here. I have these references where I got my information from. I have a DVD clip about piriformis muscle, but it will be difficult for me to put it on the browser and play it. It's about 20-second DVD clip. However, so next one, very quickly, I have a little time, 25 minutes gone. Here is coming molecular level. I'm talking about pain. What is wrong? What does thing go wrong at molecular level, at microscopic level? Here is our healthy blood cell. Folks, listen here. In this healthy blood cell, it takes minerals from sodium, potassium, calcium, magnesium, all the 9 yards. You get it from the food. You get nutrients like vitamin. You get it, nutrients. You get vitamin. You get from fruits and vegetables, and you oxygen you breathe. And it looks okay. You're breathing oxygen. You are not breathing oxygen which your lungs need 100%. Your lifestyle is such, you are stressed, your nerves get uh, squeezed, they're under tension. You compromise intake of oxygen, you have lethargy, you don't go for a morning walk, you don't go for a swift morning walk. You do not make up enough oxygen level in your blood. However, when these three are maintained, minerals, nutrients, oxygen are maintained, also you shed out toxins, carbon dioxide, and waste. When intake of minerals, nutrients, oxygen is balanced with thermodynamically balanced, chemically balanced with toxins getting out, carbon dioxide going out, wastewater going out, you cannot have a pain, you have a healthy blood. It also helps you keeping other parts of the like hearts and liver and kidneys strong as well. Once you have a healthy blood cell. If you don't have if you compromise your oxygen, you compromise nutrients, you compromise your nutritious food, minerals in your body, what will happen? Why I want to raise this point, folks? Your cell has a fixed volume. If one thing goes down, other ways go up. If your carbon dioxide oxygen is low in the blood, carbon dioxide will go up as toxin. Wastewater will go up. You're increasing the level of toxin and carbon dioxide in your blood cell. That results in weakest spot in the body. Back is the weakest spot. It will hit you over there. Any part of the body where there's a weakness, blood is not giving the supply of oxygen to that tissue, you have a pain over there. A lot of people like my shoulder is hurting, I have migraine, my knees are hurting, my ankles are hurting, my wrist is hurting, I have a carpal tunnel. In the Bay Area, people are complaining 30, 40, I have a carpal tunnel. They are living in a postural position. Their hand, their wrist is right on the table, on the mouse all the time. They're impeding the supply of oxygen to the cells in the hand there. You're creating a problem over there. Yourself, you are the problem. You should have the solution here. Here is another one here that, having said that, that there is a thermodynamic imbalance between intake of minerals, nutrients, oxygen, and excretion of toxins, carbon dioxide, wastewater. There's an imbalance, increases the toxins, carbon dioxide, wastewater. And the lower picture shows here, this lower one here, that this picture clearly will show that from your artery, you get healthy blood cells, which are full of oxygen, full of nutrients, full of vitamins. Then they exchange. You see this little yellow picture, oxygen goes to the cells, to the tissues. Nutrients go to the cells, to the tissues here. And from your tissues, it takes up the carbon dioxide, it takes up the wastewater, it takes up the toxins. This in blue, they are exhausted blood cells. These exhausted blood cells go back to the heart through your veins. The heart processes them. It recharges with oxygen, recharges with anything, all it needs, and sends back to the arteries. And the cycle goes on. You will live a very healthy life. Where is the problem? When you don't have intake of oxygen, when your your red blood cells are not healthy, they do not have enough oxygen, they do not have enough nutrients, they cannot exchange that oxygen nutrients to your cells, to your tissues, cannot exchange it. That is where your pain starts there. That's the core of whole thing here, core of pain here. My therapy started with, I used to walk like this one in the middle picture. I used to walk like this one. This type of walking naturally gives you your oxygen supply will be impeded. This is a bad way of walking and there's a good way of walking. If you see in this picture here, folks, I used to walk like this one. Now I walk like this one. You can see the sky in different, the two types of walking here. In order to walk, I need to have a strong bones. Bones you get strong by how you get it? You get from vitamin D. Either you can take 2000 mcg units, 5000 mcg units of vitamin D from Costco, or you can, but that will leave their own effect. Vitamin you take how much they're affecting your kidneys. You're creating, getting rid of one problem, you're creating another problem. Those vital lead, lot of bad stuff, and difficult for kidneys to handle those things. If you're on a number of pills here. So natural way for walking straight and walking swiftly is to have enough vitamin D in your blood cell. Your annual report should tell you how much vitamin D is it in therapeutic range, is oxygen therapeutic range, is carbon dioxide therapeutic range. Are all these things are there? Ask your doctor, get your annual report. If any parameters are out of range, the laboratories which test your blood, they give you a report. You get your copy. Don't leave it with your physician. Physician have a lot of patient to worry about. Patient bothers only if the laboratory says send a signal, out of range. But laboratory doesn't sell this in range, but range is although within the range, but upper limit of the range. Carbon dioxide close to very upper limit of the range. Oxygen, although is in the range, in the lowest of the range. That's where the problem starts. You got to get your own blood sugar, get it checked up. Bug your physician. I want this, I want that. Next year you go for a blood test. I want you to see that your blood, all those parameters out of range, they are coming within the range. Your pain will start receding, not only back, in other areas also. Folks, here is my story here. I came to California 1999. 2000, I was like this one. Before that, I was in Connecticut. It was very, very cold. Cold wind hit my chest. I was ending up in hospital, breathing issues every other weekend. Coming to California to the 9 was a blessing in disguise. My problem was weather related. My health started improving. However, my lifestyle, which I had to drive from Stockton to Santa Clara, good 2 hours every morning, coming back in the afternoon in Highway 580 traffic, and the 210 high power in the evening, that was devastating. That created a structural problem in my back here. It started sinking. Although you're getting happy dollars, sure, you have a title, you are traveling on the company expense in aeroplane, you're building a lot of mileage points there, looks hunky-dory. But at what cost? This was in 2003, 2006, 2009. I was totally unable to sit, stand, do anything. Ultimate decision made to go under the knife. This is under the knife here. Slowly, it come back to the 12. And the struggle I went through from this stage to this stage after this under the knife surgery, my left nerve was damaged in the surgery, but nerves communicate with the muscles to keep blood going there. However, an injured nerve rather than severed nerve, injured nerve will slowly stop giving oxygen supply to your muscles. So it can take a year, 2 years even, for that nerve to totally die. And that muscle which gets this oxygen supply from that nerve, or communication from that nerve, that muscle eventually dies there. Year after, my left foot start dying, left leg start below the knee, start thinning out. I go to my surgeon who did surgery. He'll give me here is your foot brace. Put this brace in your shoes and come back after 6 weeks. Wow. I said, okay.
Recording in progress.
Things will not. I have time, folks. I have time to, or you want me to wrap up or continue?
I think you have time, Satish ji. It's only 6:36. Deepak ji, what do you say?
Yes, you do.
Okay. I went through the 11, things were not improving as far, very sad. And I went to Davis in hospital, university in Sacramento. They told me you keep the mobility up. Your muscles in the left foot are dying. If the leg is thinning out, you got to retrain your muscles and do as much mobility as possible. All the things I've told you, they told me all that. I even went to India in Haridwar, in Ravindra ashram. They taught me some exercises to correct the piriformis muscle there and sciatica nerve. I practiced those there. They are all in my DVD clips here, but unfortunately unable to bring them out. With that help, by 2014-15, I resigned my job, focused a lot more on my health. And over the last 4 years, I'm religiously following my own instructions, which I've given in this presentation and my DVD clips. I don't have a pain. I claim I don't have anything. I really, I say it's a miraculous. I don't have. What the key is that I get up in the morning, 5:30. I spend 35-40 minutes, do my morning stretches. Morning stretches, I do it. And then I go once a day out of my home. And whenever I go for 3-4 other things get together, first thing I go to my health club on March Lane and Highway 5. And there I go, I spend 35-45 minutes there. I do my stretch. I stretch my peripheral muscle. I have exercise for it. I have exercised all major joints in my body. I spend over there. My oxygen start flowing like great. Really, really. There is a strength in my eyes. There's a power in my eyes. There's a blood flow in my eyes after when I get out of the health club there. That spending 35-45 minutes buys me, folks, another 23 hours of the day. 1 hour in the health, 15-20 minutes at home, 45 minutes in the health club, 1.5 hours total buys me 22 hours of the day, pain-free, complaint-free, smiley face. I get all those things there. That's it. That's my presentation about. Now I have to struggle with the DVD clips. Help. I need help over here.
Narendraji, would you like to continue with the DVD display?
Narendraji.
I think you should, Jalota, you just close this one,
and then close it. Just close it, okay?
Close this one. Other one, yeah. Then share the video one, the clips which you want to share it. Just double click on that one, from the folder.
How do we get to the folder? That's my hiccup here. Can I minimize the screen current screen? Can I minimize it?
Yeah.
Minimize it. Okay. Now I can get to that.
Yeah.
Okay. Here is my folder.
Yeah. Just double click on the one which you want to share it, and
then double click.
And then click on share.
On share. Okay.
Yeah. Click on share, and then once you do it, then you will share. You do this.
I don't find the share on my screen here.
Okay, just minimize this one, the one which you open it up.
Minimize this one. Okay, minimize this one.
And you'll see the share screen on your bottom of your screen, right on the Zoom meeting.
It's a green button.
Yeah, green button on Zoom, green. Do you find it?
No.
Okay.
Can you take the host? Can you become the host?
I will come.
Can you become the host for momentarily? Okay. I hear you. Okay. Can you know?
Folder one DVD one.
This is DVD folder.
Open it.
Okay. Yeah.
Now,
Okay.
Where the Zoom meeting?
That वो तो पीछे लगी हुई है दिखना था हो रही है
अनु करो
अनु
हाँ first you have to share the screen.
This is Zoom. I don't know where the Zoom is right now. Yeah.
It should be this Google.
This one
or this one. Yeah. Click it. It's not opening.
No.
So do one thing, Alt Tab. When you do Alt Tab, you will see
Alt and Tab.
Alt and Tab.
Yeah, Alt and Tab together.
Yeah.
Yeah, Alt and Tab. Then you will see, you'll be able to switch to your Zoom meeting, and then there you share it. Or minimize everything. There should be on the on the zoom on the bottom of the screen on yours.
Zoom icon, yeah. Return to meeting. Go to return to meeting. Go. That's good one. Here we are.
This is the share screen.
Share screen. Yeah.
Now you have
Now
to
you go
open-
here. Now you go here.
Now you go here
Open this one. Yeah.
and open this.
Open this and open this. Yeah.
Now it's good.
Are you able to see it or?
Yeah, we see your screen. You have to open the video.
Video. You are able to see the video? No, not
No,
yet.
no, I don't see the video. I see the list of videos. I'm looking at your screen,
Can
perhaps.
minimize that list. Okay, here. Okay. Now you see that.
It says movie file. You have to probably double click on it, the file that is showing. What?
He has to stop, share the actual video that is opened up.
Actual video now.
Question is it open?
It's open. He opened it, but he has to go to the green button again
Yeah.
and share the video that has opened up now.
Go back to green button. Okay. No, they're only seeing this one here. They're not seeing this.
Why so?
Yep, minimize this one. Where you're clicking it, just minimize that one. X is.
Go to the green button and share the actual video that has opened up.
Actual video.
Yeah,
Oh,
there you go.
There you go.
And play it.
Okay, now you have to push that triangle in the middle and bottom there to run it.
Next one to the journey. Okay, here. This one is at home. What you're doing, folks, you have, if you're seeing me here, say this is your spine. What you're doing, you're giving twist like this one, like this one. The next exercise would be do like this one, like you're squeezing your clothes like this one, towel, like this one. Then third one, you will do like this one. Then you do like this one. If you're able to do these 4 exercises with your spine, any deformity in your spine will not let you do these 4 exercises. It's a preventive step. If you can keep up with these 4 exercises every day, your spine will never be crooked, will never give you pain. You will have a healthy spine. You cannot do these 4 exercises if you have pain, any deformity, any pain. So this is my secret here. 4 exercises, minimum 4 exercises every day. Keeps the blood flow in your spine at all levels, all throughout the spine. Like this one, go like this one, go like this one, go like this one. Very gently 4 exercises there. Okay, I'm showing only 10-second DVD clips here. Now my next exercise I'm going to show here. This is the opposite of the first one, folks. This is the opposite of the first exercise I showed you. Opposite of that one.
The first video did not show. It was still. But continue. That's okay.
One more.
No.
Here. This is the first video.
Yes.
See that?
Okay.
I'm doing like this one, like this. And the next one, you're doing like this. Now your spine is going like this, like that. Next one. This is a complete spinal stretch, Whole spine gets a stretch. That is showing like this one. The next one will be, see? This is the secret. This is your piriform muscle gets a complete stretch here. If your intake of oxygen is there, you're going for a swift walk, you are eating nutritious food, healthy food, taking your vitamins daily, and you remain active and mobile, you will be able to do this exercise. By doing this, you are stretching your piriform muscle right over here. This is a back extension. See, any deformity which has been created by your forward motion of your torso, if you're walking forward with the torso tending to be forward, this exercise takes care of that deformity. Here. Here in this exercise, you are strengthening your shoulder blades and not upper back. This exercise strengthens your shoulder blades and upper back. Still नहीं होने still नहीं. Okay, folks, in this exercise, it strengthens your gluteus, your buttocks, it strengthens your quadriceps as well as hamstring. If you can strengthen your gluteus, quadriceps, hamstring, and your shoulder blades and upper back, there can be no reason why there should be a pain in the low back. Low back, when we try to diagnose and treat low back only, we do not give any attention to our shoulders and upper back, our gluteus, our hamstrings, our quadriceps. We don't give any attention to that. Back pain will never go away. Doesn't matter how many surgeries you have, how many pills you take. Doesn't. The whole body has to be taken unison as one thing. Each thing, upper back, your buttocks, your quadriceps, your hamstring, your shoulder blade, they all support each other. When you have those working, you will not, this is the way to get rid of your back pain if you ever had it, or you have it. You need to do this as senior years, even if you don't have a back pain, so that it doesn't come to you anyway. You got to do this thing. I do it for myself. I speak for myself more or less. When I say you got to be, I got to do it. To these things there, hour and a half daily, 2 hours up to 2 hours daily spend on your health, you will not see back pain. Back pain is the third, fourth largest disease in the country. Every other person, fourth person see walking on the road has a back pain. Every second person senior has a back pain here, and becoming very prevalent among high school, the college students. I mean, they come out because their lifestyle is such, and so are the IT professionals. So are those professionals who drive long distance, take a load from Sacramento, go to Texas, come back within 3-4 days. The problem is going to hit them. If you understand how you bring all the deformity you have created during the whole 3 hours, they can go away, washed away with 1 hour of exercise and taking care of, coupled with healthy lifestyle. When the health pools were open, you see this exercise in water. In the water, you are able to raise your leg 90 degrees to the torso, which you cannot do in the air. You can rotate your leg in water. Okay, folks. That is what keeps us going, keeps me going at least. And you can see there's a smile on face. You see my face here. How smiley it is. There's no, if there was a pain, there will not smile on it. You can have either smile or pain, one of the two. You do these modalities, you will not have pain.
People didn't have cell phones.
So I have few more, but still picture clips, but I'm unable to get to those right now. But this should be enough for now. So we have done about 50 minutes now. So we have to have some question answers also.
So thank you so much, Jalotaji. That was absolutely wonderful, and some of the material was really fascinating. I can really see that how timely this talk is. We've been going through the pandemic nearly 2 years now, and everybody is working from home, lockdowns, ability to exercise is little. So these exercises will definitely come in handy for many people, because working from home, although one hand it is a pleasure that you are not driving to work and so on, but still you have to sit all day and look at a screen, and of course it puts a lot of strain on your back. So as always, I always have few comments, few questions, and I ask the audience today to start typing their question if you so choose, or prepare your question if you have not already thought about, so that Jalotaji can answer. I also have realizing that Jalotaji is a non-physician, non-healthcare provider expert, and he is sharing his own experience. One of the things that I wanted to ask, he said in his narration that he went to India and then learned some yogic exercises, and which he also showed in the gym. Jalotaji, did you also try any other complementary or alternate medication modalities which are available other than allopathic and non-surgical?
No allopathic medicines, no allopathic, just naturopathic, Ayurvedic, naturopathic.
Okay, so there are. So you did try Ayurvedic also?
Yes, sir.
Okay, how about specialties like homeopathy?
In homeopathy, there are certain herbs, natural herbs from plant-based herbs. They calm down, quieten down your nerves. Nerves are so mischievous, and there are natural herbs, plant-based herbs available, which can calm down. I can give you one name called Tensicam. I bring it from India. I have another one. If you give me a second, I'll grab it, show you the box here.
Meanwhile, as Jalotaji is grabbing the medication, I would like to say that we are very lucky to have on our membership some of the top-notch physicians and healthcare providers, physical therapy, that would like them to make comments and validate the material that we covered today. Our preparation, especially the anatomical slides that he showed and the way he explained them, and of course videos, it shows that how much preparation, background preparation he has done. So I definitely congratulate Jalotaji on that effort. But Jalotaji is back, and I'll call upon my experts who are available and are listening to the lecture today. Jalotaji, are you? Okay. So we have our career physician, Dr. Dheeran Nanavati, very well known in our community, as well as to our membership. He presents frequently on this forum, and he's orthopedic surgeon, as you all know. So I would like to hear his comments after Jalotaji is done with his comments that he is showing. Yes, sir.
Here is a medicine. It's called Tensicam. You see here, it says Tensicam. Are able to see? Here it is. Tensicam. Mm-hmm. There's a picture of in yoga posture, and it's written here, Tensicam and Ayurvedic medicine. It's listed under an Ayurvedic medicine. Okay. It calms down inflamed nerves. It calms down inflamed nerves. But it doesn't mean you are going to San Diego from Sacramento. You're halfway through, you get a pain, you take it. You do not take rest after that, it will not work. Mm-hmm. You take aspirin, you get Vicodin, you will be able to drive further, because those things separate your mind from your brain. You feel as if there's no pain on allopathic thing. But with this one, you cannot have this and take rest as well.
We
This works
appreciate your
only.
experience with that medication. Dr. Nanavati, we would like to
Second
hear
one.
your comments.
Second
Your-
one is here.
Right. Can you
Thank
hear
you.
me?
Yes. Yes, we can.
Okay. Thank you very much. First of all, I must say that for about 40 minutes, 45 minutes, I felt as if I was attending a lecture by a professor in medical school describing all the common things that we need to know about low back pain and sciatica. So I must say that Mr. Jalota has done an excellent job summarizing common features of low back pain and sciatica. Because of paucity of time, and I'm sure there are other people who would like to comment as well. I would just like to say that for almost 25 years, I was an orthopedic surgeon who was also doing back surgery for spinal stenosis and sciatica and herniated discs. So, with that background, I would just like to make some takeaway points or take home points for the audience. Number one, myofascial pain is one where muscles, ligaments, and tendons in the lower back are affected. Usually, this pain does not go down the leg. And when the pain does not go down the legs, you can treat it conservatively. It does not require surgery. All the points of treatment that Mr. Jalota recommended are excellent suggestions. Exercising, good posture, good nutrition, etc., are very, very helpful. And majority of people can get over the pain if you strengthen your core muscles. Once the pain starts going down a leg, and especially if there is some tingling and numbness, if the pain gets worse with coughing and sneezing or bending, you better take medical advice because that means that one of the nerves in the lower back is being pinched. When the nerve is being pinched in early stages, you don't get nerve deficit. But if you wait too long, you can get weakness, you can get nerve deficit because oxygen is deprived from that nerve by either a herniated disc or from arthritis, and that nerve may not recover as well as in early stages. So if you have sciatic pain, sciatica means pain going down the leg. If you are getting those symptoms, you are better off taking advice from a doctor. Now, in our audience, I'm sure there are a lot of elderly people, and he did refer to something called spinal stenosis. It's a common condition where the spinal canal gets very narrow, and it can affect more than one nerve. Usually, one disc affects one nerve. Spinal stenosis affects multiple nerves. What are the features? You get pain in both your legs. You get spasms, and most important thing is that if you go to a shopping center, you cannot walk around the shopping center unless you have cart in your hand. The cart helps by changing the posture of your lower spine. So that is the classical sign. It is called shopping cart sign. So if you have spasm, pain, tenderness below the knee, bilaterally or both sides, and you are elderly, you are likely to have spinal stenosis, and you should get medical attention for that. One small suggestion: if you are in a habit of carrying a hard wallet in your back pocket, avoid doing that. Keep that in your front pocket because if you are doing long distance driving like Mr. Jalota did, and if you are sitting on a hard wallet, that is sitting right under the sciatic nerve. And quite often, this simple step helps relieving some of the pain. Treatment wise, he mentioned everything. If conservative treatment, including epidural, doesn't work, and if you are diagnosed to have herniated disc, sooner or later one would end up having surgery. So that is something that herniated disc does not get better on its own. A bulging disc can be managed conservatively. And in nutshell, avoid bending and heavy lifting, core muscle exercises like Mr. Jalota showed, decrease your weight, good diet, control your diabetes very well, get expert help from physical therapy. And at some point, I would like Dr. Virtu to give us a whole lecture on how to do lower back and general body exercises. I think that will be very helpful. And of course, calcium and vitamin D. So having said all this is a big subject and a complex subject at that. but Mr. Jalota did an excellent job in a short period of time. I commend him for that. And I really appreciate everybody to give me opportunity to make these comments. Thank you.
Thank you, Dr. Nanavati. That was wonderful. Very inspiring words, as well as the medical content that you stated. Back pain, orthopedics, physical therapy, and lifestyle modifications, they go hand in hand. Putting slide on the pressure on the spine was very informative. Thank you for sharing that. I really appreciate your comments. Thank you so much. Whenever we have back pain and we fail rest for a couple of days, and your IC hot or typical analgesics that you pick up from the pharmacy, and all of that fails, the first person that you pick up the phone and call is your primary care physician. So primary care physicians have a great role in guiding you what to do, whether you stay with the lifestyle modification or you go for x-rays and MRIs, or you go for consultation with orthopedic surgeon followed by physical therapy, or directly go to physical therapy. So there's a lot of decision making that takes place, and I'm really privileged today to have everybody's well-known, very intelligent and dearest physician, Dr. Sharad Arora, who is online, and I would ask Sharad to please join us and make some comments on the material today.
Hello, Mr. Jalota. Did a great job on explaining the situation for the majority of folks, 98% or so. When back pain happens, it's mostly musculoskeletal, sometimes sciatica from a bulging disc. And we give medications, but they're mostly so that people can do their exercises, not necessarily because the medications themselves will do anything to help with the situation. They are mostly to cut down the pain so that folks can stretch and exercise the back to help it heal. There are some things that we don't expect to see with pain or with back pain that we worry about. So one is fevers. If you have a fever and a back pain, we want to know, contact some kind of medical specialist. If you have weakness, and I don't mean just weakness due to pain. So the pain is preventing, some movement. That's different. This is literally, despite the pain, you can't pick up your leg or your foot or what have you. Then of course, get somebody to check on your back. Those are important things. Majority of times, again, between exercise and we used to tell people bed rest. It turns out not very good, idea for back pain. Literally moving and stretching and doing everyday kind of, no heavy lifting, obviously, but otherwise normal everyday chores and things can help with the back and stretch it out. So we no longer prescribe bed rest for back pain. So if it occurs, we tell people keep shifting positions. Don't sit too long, don't stand too long, don't walk too long, don't do anything for too long. Keep shifting, and that'll help quite a bit.
Thank you, Dr. Arora. That's very intelligent comments, actually, and guiding people to seek help when the help is really needed before they sustain long-term damage. In the chat box, I'm looking at, there were a number of compliments for Jalota ji about your preparation and your presentation. People really liked it. There is a question from Simi ji, could you show lumbar roll? I think she meant to say the picture of the lumbar roll, or is it the exercise that would be called lumbar roll, Simi ji? Can you clarify that? You have to unmute yourself if you're going to speak. And while she's looking at the unmute button on her device there.
Hi, I found it, sir.
Okay, go ahead.
I actually put it in the what do you call, the chat, the picture I wanted to see, but it's okay if she doesn't have it, she's not on.
She showed a picture of the lumbar roll.
I know, I just wanted to, that's it. Thank you.
It's just a little roll that goes behind the spine.
Wonderful. My son recently bought the same car, and I'm sure he'll have all these wonderful things. I just took a little ride with him. I don't know.
Yeah, almost all the new cars in last few years have this kind of, you just have to ask your salesperson if you're buying a new one. But as Virtu said, you can be innovative, and even a roll of towel can do the trick while you're trying to buy. Any other questions, please?
Buy from Walmart online, Amazon online, you get it.
Yeah.
That's called innovation.
Yes, yeah, that's what is needed. Any other questions before we call it day? Or comments? Comments are welcome. You would like to say something, you would like to add something, somebody would like to have some editorial comments. I have a comment that I'd like many of the members who show up on for this forum and the back to school both are here, they are regulars, and I'm seeking their help in promoting our services. These are invaluable talks, invaluable information. That's what keeps you coming back here. Might as well share with your network of people. If we send an invitation for a wedding, we can easily invite 350 people from our network. So maybe 100 are common, but still we can go ahead and start sending the emails, the WhatsApp links, and introduce the American Desi Society and the work that we are doing, and it will benefit them. Of course, we would like to see more membership, but our charter is to provide help to people and educate them and increase the awareness of the health conditions that general people have. So I'm requesting all the members and guests who are here, who repeatedly show up on our programs, to please help us. And with that, I think I'd like to close today's meeting. Congratulations, Jalota ji. You have addressed a wonderful topic and made us aware. And I thank you, my experts today, who have really polished this whole thing in our head, that many people will learn, including myself, that what I need to do. So thank you so much, everyone.